Hi guys. Today we are celebrating International Women's Day, and we celebrate that when?
On March 8th.
Perfect. So March 8th is a day that we take to celebrate women around the world and their achievements. Although I do think we should celebrate women every day.
At least a month.
At least a month, right? So we celebrate things that women have done around the world, from scientific discoveries to running businesses to running governments and taking leadership in all things around the world. And one of the things that we want to focus on is our health, right? Women's health. And so there's a big call to action about taking our health as a priority and looking at how we protect our health insurance and our health benefits so that we can live long and healthy lives. And so as we talk about that, Autumn, what would you say is one of the things that we should focus on when we think about women and their health and all the discrepancies that sometimes occur between women and men?
So I would probably first off hit heart health, because all the symptoms that we're usually taught or that we usually review are usually symptoms that men feel and not necessarily women. And so, for example, if a woman is presenting with any sort of like heart disease or heart attack, sometimes they just say, I just don't feel good, or like something feels off. But they don't necessarily have that typical chest pain going down your left arm, up your neck, or anything that would kind of key us in like, oh, this is exactly what that is. Sometimes they're just like, I just don't feel good. Something feels wrong. And that's what it is.
So from that perspective, when a woman shows up in the emergency room, a lot of times her symptoms are dismissed, right? Because she just doesn't feel right, or she may feel tired, or she may just feel nauseous, or even complaining, stomach pain, heartburn, things like that. And so sometimes they're just given a medicine and told to like follow up with their PCP, when in reality there could be a blockage or something wrong with their heart. And statistics say that we do not catch this in women as much as we can catch it in men. So that means that our heart can be affected when someone else doesn't recognize it, which means we don't get the proper treatment. So what would you say to those in healthcare who are caring for women and to women in the sense of how they should advocate for themselves?
Those in healthcare, I would probably say, I think everybody in healthcare usually wants to cross their T's and dot their I's and do their very best job, because even though it is a job per se, I think that people who go into healthcare know that they are dealing with life and death, and that if they miss something, it will haunt them for the rest of their life, to be completely honest. So in order just to prevent that, at the very least, cross your T's, dot your I's, and also just make sure that like you checked it. If you did and it's negative, okay, great. But it's just one of those things where like if you miss it, or if you think that you miss it, you're not going to sleep.
Yeah. And for women who are experiencing symptoms where they really just don't feel right, how would you encourage them to advocate for themselves?
I think that is the thing, is being your own advocate. And so even though you may say like, oh, maybe I'm just fine, let me just push it off, or let me just see if I feel better. If you don't feel good and you know that you don't feel good, come in, either go to the ER. We can do EKGs here too, so we can do like the screening exam. But realistically, if you're like, I do not feel good, you've lived in your body every single day of your life, so you know when something is wrong. If something is wrong, you have to stand up for yourself, because unfortunately it's not necessarily made for you. And so sometimes you have to kind of be more forceful than we kind of like to be.
Yeah. But and so advocating for yourself is something just as simple as saying, I just want to make sure my heart is okay. Were there any tests that was done on my heart, right? The other thing that I think people don't think about is we're so used to taking care of everybody else, right, that we don't always take care of ourselves. But in these instances where something just doesn't feel right, take someone with you, right? Because sometimes your family members are able to advocate for you as well, right? So the husband, the loved one, the child, that may know about your health issues or your medications, take them with you, because sometimes in the midst of things, they may think of other things, or they may ask questions that you didn't think to ask. So have someone with you as well. And then remember that if it doesn't feel right, get it checked, right? Okay, so we talked about heart health, but there's so many other things that affect women that we should really be talking about more and having a call to action. So one of those other topics I think is reproductive health.
For sure.
Yeah. And so when we're talking about that, like, we use it, but this is related to our fertility. This is related to pregnancy. This is looking at mortality in women when it comes to, hey, if I go to the hospital to deliver a baby, I expect to leave alive and healthy, and I expect to go home with a healthy baby. And sometimes that doesn't happen. And sometimes that doesn't happen because of the way the system is set up. And sometimes that doesn't happen because we don't know when to talk about symptoms that we're experiencing. So what would you say in relation to reproductive health?
I would say, honestly, I think that finding a provider who suits you is probably going to be your very best bet, because I do not expect any patient to become a provider or to honestly have the same depth of knowledge. But I would advocate for them to find a provider, whether that's us or someone that you already have, who listens. Because at the very least, their knowledge plus your symptoms should give them a plan, whether or not what road that goes down, the fact that it's being worked up and cared for, you're in good hands. Yeah. Versus just like, oh, you have crayon crimping with your cycles, so does every other woman, you're fine. It could be serious, or they're told that, like, yeah, every woman bleeds, and then we do their complete blood count with their regular annual, and they're severely anemic. And so sometimes it's hard because they get dismissed, so they think that this is just normal, whenever it is not normal. Yeah. And so the best that you can do is honestly find a provider that you like, who listens.
Yeah, so connecting with that provider is really important. If you just don't vibe, it's okay. You know, there are multiple providers out there, and sometimes we don't connect with everybody, and everybody doesn't connect with us. But you want to make sure you find somebody that you connect with, right? And then, like you said, if they listen, then that's going to take you a lot further, right? So they won't be dismissive of your symptoms. So whether it's anemia, whether it is contractions that you are having while you're pregnant, whether it is a headache, and them knowing to check your blood pressure when you're pregnant, to evaluate for things like preeclampsia, because those things do kill, right? And so that way, if that provider has a listening ear and there's a connection between the two of you, you feel comfortable talking about your symptoms, right? Yeah. And then that way things can be done, right? Because we want healthy mommies, healthy babies, healthy women in general. And the only way that that's going to happen is to have a provider that you connect with, so that we can decrease these health disparities that occur. Okay. So we talked about heart health. We talked about reproductive health. Anything else that we see that may affect women a little more than men?
Yeah, I think that you kind of made an allusion to it earlier, but I feel like women usually are the backbone of families, if you will. So sometimes women kind of pour into everybody else before they pour into themselves. And so sometimes that means that there is nothing, or an empty-ish cup. And so that would be more mental health related in regards to like stress, anxiety, mental load, and stuff like that.
Yeah, and we see that, I feel like, every day.
Oh, for sure.
And then the way the world is now, there is so much going on, right? And so a lot of times we try our best. We care for family, our children, our husband. We are the caregivers. If anybody is going to be a caregiver for the elderly, we go to work, you know, we cook, we clean.
After school activities.
Oh my God, dropping kids off. And so with all of that in 24 hours, there's not a whole lot of time to pour into you. And so over time, what a lot of women start to feel is what they describe as feeling overwhelmed, right? Overwhelmed or stressed. That's what I hear, because nobody really uses anxiety and depression, even though those could be telltale signs of where you feel. And like you said, if you have poured all day, eventually you won't have anything in your cup to pour from. So how do you pour back into yourself? And that's really important, because if you don't, then that's what causes anxiety and depression. And statistics say that women are 2 times more likely to experience anxiety and depression than men. Because if you live in a traditional household, so to speak, right, the man goes home and goes to work, he brings home the bacon, but not every household is there where a man is caring for the kids and helping them with their homework and giving them a bath and cooking and cleaning. And so sometimes those, quote, domestic roles still fall on a woman, even though she is also going to work. And so that being said, that definitely can lead to more anxiety and depression. So if a woman is feeling overwhelmed, or if a woman is feeling stressed, or if a woman is feeling like, oh my God, I am up to here and just can't take it anymore, what would you advise?
I think it really just depends on the severity and what necessarily is impacting it. Either way, if you are starting to get to the point of like burnout, or if you're even starting to like feel it a little bit, I would definitely say tag in your help, whether that's your family, your immediate or extended, or anything like that, because you usually don't want to get to the point of burnout, because that requires recovery period. It's not just like one day off and I feel great again. It'll be a few weeks or months before you're like, okay, I can do everything that I used to again and be okay.
And feel yourself.
Yeah. And then it'll get busy again, and then you'll get burnt out again. And it's just this vicious cycle. So I would say really rely on your village as much as you can. But sometimes we just don't have a village to rely on.
Yeah. And women are truly superheroes, right? They are super women. They do a lot. And so we want to make sure that you are also making sure that you care for yourself. And that's really important. So like you said, use your village. We don't ask for help as super women, right? We just pile it on. We take on more, and we're just like, oh, we could do it. Or they come in and be like, well, yeah, I mean, I got a lot of stressors, but that's life. It doesn't have to be life every day. And so you definitely want to be able to like recover, like you said, from it. So ways to recover, self-care can include, I think you were telling me this past week that you scheduled a massage and got your nails done. And so is that part of your self-care?
It is, because I swear up and down that I'm not an anxious person. If I do not get a massage once a month, I get chronic headaches from tension in my shoulders, even though I'm not stressed or not anxious. So like, even though I don't necessarily feel that way, my body tells me that I feel that way. And so my masseuse scolded me for skipping last month, and I was very sore the next day. But even though we don't necessarily like, I don't feel the mental load or anything, but my body will say, whether it's like the tension in my head or my neck, or some women just have like pressure on their chest or stuff like that.
Yeah, or even just like noticing that you may be a little more irritable, right? Or snappy. Sure. Like I noticed that I need a little break about once a quarter, like every 3 to 4 months. And so vacation is really important to me, or time off, or being able to like release and spend time with friends and family is like really important, because if I don't get that replenishing and that pouring into me and that relaxation, that time to just like love on others and have others love on me, I notice that I can be a little more irritable, you know. And so small things that didn't affect me a month ago, then I'm like a little short about it, you know. And so the loved ones around me don't deserve that, and I don't even want to give that out. So it's really important to have time, right? Time to vacation, time to myself.
Or even if it's just like early morning, I just want 30 minutes to myself to go on a walk and to clear my head and get ready for the day. But 30 minutes where I'm not caring for others, I'm just caring for myself, or just like reading or meditating or however you will.
But. So we would encourage women to take time for yourself, to pour into yourself. And if that is not enough, it is okay to ask for help. So ask your village to divide and conquer. If you feel overwhelmed at home, split the responsibilities between you and those in your home, right? Also utilize your village when it comes to like, are there counseling resources? So that could be your church, that could be a counselor, right? Really important to have somebody just to talk to and be able to get things off your chest. And then also, I tell patients, because a lot of times we always think about medication from like here down, right? Like if I have a strep throat and the doctor tells me I need an antibiotic, I don't know anybody who's going to say, oh no, I don't want that antibiotic. I can do this all by myself. I can fix this strep throat without that antibiotic. I don't like medicine, right? People will take the antibiotic to feel better. If you have pneumonia, you're going to do it. If you fracture something, if you break a leg, right? Are you going to tell the doctor, oh no, don't give me any medicine, don't fix it? No, you're going to go to the doctor. You're going to take the medication that is going to help for you to heal. If someone had cancer, I have never heard anybody turn to the person with cancer and say, you're not strong enough to fight cancer on your own. You should be able to take care of this by yourself with no medicine. We don't say that about anything else except for mental health. For some reason, there's the stigma that, Oh, no, I don't need medicine. I can do this by myself. I'm strong enough. I'm not weak.
Well, I think that's also because we don't necessarily always acknowledge the cause, usually, which is just a chemical imbalance in your brain. I cannot force my brain to use all of the serotonin or dopamine or whatever it may be that's already there. I do not have that ability to force my brain to. Those are my individual cells who do not care what I think or say or do. And so this medicine just kind of helps what's already there. It's not giving you more dopamine or anything like that. It's just giving your body the ability to use what's already there.
Yeah.
And it works because it's not your fault. It's just the chemicals flying around.
Yeah. So I think it's a good thing to think about if medicine is needed. Just like for strep throat, you take it for a season, right? For a cancer, you take it for a season. And sometimes there are seasons in our life where it is really, really stressful. And if there is something for that season to help, so I'm not so anxious, so I'm able to sleep at night, so I think more clearly, so I'm not irritable, it is okay to say, hey, maybe this is a season where I need a little bit of help to get me over the hump. And I'm not kind of walking in this like dark haze, so to speak. So I would encourage people that if this is a season where it's really, really hard, reach out to your provider. We don't just willy-nilly give you a medicine. You know, we try other steps. And then if there is a time where you need it, just like anything else, from strep throat to cancer, use the medicine if it's there to help. And then when that season is over, guess what? Come off of the medication. Okay, so mental health, reproductive health, heart health. Okay, so I think we've hit a lot of things when it comes to women's health in general. And the one thing I want to make sure that we talk about is, how do we prevent? Because if we do preventative care, then ideally we don't have a heart issue. Ideally, our reproductive health, we're fertile, we're healthy. When we're ready to have a baby, we can. And we're not dealing with a lot of mental health issues. So what is the one thing that women should do from a prevention standpoint?
I would say make sure that you have your annual wellness check every single year. But women actually have two, not just one.
Yeah.
So the one that every human gets is just checks like heart, everything, and then the one that women specifically get is more geared towards like our female reproductive organs. But we also still check mental health. We also still check like, do you have chest pain? And so you get the full workup.
So men have an annual physical once a year, and women should get both an annual physical and what we call well woman exam. So the well woman exam is that time to talk about things that affect women. So whether it's birth control, whether it is mental health, whether it is your pap smear and cervical cancer screening or breast cancer screening, all those things are discussed that relate to women doing a well woman exam. It makes sense, right? And then the annual checkup is literally what a human being should have. So those are the parts that men and women have, from our ears, our eyes, our nose, our heart, our lungs, down to our toes. That is when that gets checked. So for our women, during Women International Day, just make sure you think about yourselves, schedule your annual and schedule a well woman exam separately with your provider. We are here to offer those things as well. So I don't tell them how they can schedule with us.
You can schedule by calling us at 832-619-1669, or even just stop by, and we will definitely get y'all seen and make sure that you're all good to go for National Women's Month, because we should have a month.
Yes. So, hey, women, we love you. We celebrate you. We are so proud of you and all your accomplishments, and we are so excited to celebrate Women's International Day today.